So to start off with introduction, so I am Catherine Covington, and I'm a program manager with InnoCentive.
Hi, I'm Elaine Chin. I'm a principal for challenge design and development at InnoCentive, and I work with clients to write the challenges that appear on our challenge center. And today we have David Arthur joining us from Elanco. David, can you introduce yourself?
So I'm David Arthur. I'm a scientist here at Elanco, and I'm working with InnoCentive on the Grand Challenges platform.
Great. All right. So first off, as listeners may be aware, InnoCentive originated from Eli Lilly approximately 15 years ago. And in that respect, InnoCentive and Elanco share similar roots. So David, can you give our audience some background, both about Elanco's history, mission, and vision?
Sure. So Elanco was actually established in 1954 as a division of Eli Lilly and Company. As a matter of fact, the name itself, Elanco, stands for Eli Lilly and Company. We're located in Greenfield, Indiana, so we're just east of Eli Lilly's main campus in Indianapolis. The Elanco division focuses specifically on animal health, and we have about 2,300 employees, so fully integrated R&D as well as commercialization organization. And through the years, we've produced products for both food animal, such as cows, pigs, chickens, and then companion animals for specifically dogs and cats. Our mission is to make life sciences work better for people by transforming animal protein production and companion animal care. And our stated vision is to actually be the #1 value contributor to customers. And this initiative is directly related to that value proposition.
Great. So let's turn a little bit to our antibiotics. And as I'm trying to go to the next slide here. So antibiotics and the threat of antibiotic resistance are topics that are reported in the news. And today we're focusing on is the animal health point of view. So can you set the stage for Elanco's role in antibiotic stewardship and connection to One Health?
Sure. I'll start with the One Health initiative. Basically, One Health is a vehicle for multidisciplinary action, controlling and preventing disease, as well as food security through a promotion of healthy ecosystems. In a sense, it's an integrated study of health across all animal species as well as humans. So it's that combination of human and animal health for a healthier ecosystem. One area of particular emphasis by the One Health initiative is the threat of drug-resistant disease, and specifically as a result of what are called shared class antibiotics. Shared class antibiotics are drugs that are used to treat infections in both animals and humans. And this practice carries the risk of the development of drug-resistant diseases that can cross species barriers and harm the global ecosystem directly through human health or through effects on the food chain. So, you know, and many of the pathogens that One Health is focused on are emerging zoonotic pathogens, meaning that these pathogens infect animal species as well as humans. And so Elanco has committed to One Health in its global cause to fight world hunger. And as stewards within the animal health industry, we've committed to One Health in particular. In September of 2015, Elanco leadership actually attended the first One Health Summit held in Washington, D.C., where we as a company committed to, among several things, to pursue an aggressive goal of finding alternatives to shared class antibiotics in our research portfolio and across the animal health industry, and develop those within a pipeline. A year later, we attended the follow-up meeting that was also held in Washington this past September, and have made significant progress toward that goal, but there's definitely more to be done. And so as part of this audacious goal, we launched the Grand Challenge in an expanding effort to accomplish this development of alternatives across shared class antibiotic usage. And as a matter of fact, the Grand Challenge itself, this platform was highlighted at that meeting.
Great. That's a lofty goal that you've set for yourselves, and great work in the past year. So let's talk a little bit more about the specific challenges that have been already launched. The first one is the prevention and control of Streptococcus suis infections in swine. So framing it for our audience, strep throat is a condition that people may recognize, and I'd like to ask you, how does this relate to strep suis infection in swine?
So Streptococcus suis is a pathogenic bacterium that impacts swine production, but it's also a zoonotic agent that can affect humans as well. The antibiotics used to treat strep suis are what's called medically important, which really means that they're shared class antibiotics. They're the same antibiotics that you would use to treat a human who potentially had something like strep throat. You would treat, pig farms would use this antibiotic to treat, and this is one of the major sources within the animal health industry of shared class antibiotic use. And so the reason that this is a challenge is because we're looking for alternatives that to these shared class that can get us away from using antibiotics in both species, but that also either helps treat or even better prevent the infection in pigs.
Okay, so the next one is, can you tell solvers a little bit about mastitis and the effect of mastitis on the dairy industry?
Sure. Mastitis is one of the major areas of antibiotic use also in the dairy industry. Mastitis is an inflammation of the mammary gland. It's due to bacterial invasion. It's an animal health issue because it causes severe swelling and pain in the udder and can lead to a lot of discomfort for the cow. It also causes dairy producers to have to dump the milk from treated cows just because they're gonna have antibiotics present in the milk while they're under treatment. And so it's both an industry loss as well as an animal health welfare issue. And it's quite costly, actually, not just in terms of milk production loss, but it's quite costly in terms of the extent to which dairy farmers have to go to prevent those infections. And so if we can find an alternative to what's currently being used, which again is that shared class antibiotic portfolio, then we can actually contribute to this goal of One Health.
Right, and you spoke about cost, so turning to this last challenge that we're doing here, what is the economic impact of necrotic enteritis in the poultry industry?
So necrotic enteritis is basically an infection of the intestinal tract in poultry is what we're focused on. And the estimates are that approximately $2 billion is lost worldwide annually as a result of these infections. Right now, the treatments, again, being shared class antibiotics, really are not ideal. And then, moreover, the push by the market to have antibiotic-free chicken and those desirable effects have really pushed us to look at what are either alternatives to shared class antibiotics that they themselves are not antibiotics, or are there other treatments out there that we can actually use to prevent these losses, because the infections continue to be a problem, And so if we can actually address these issues in a market-friendly manner, then we have a solution that fits both the animal health need as well as the consumer need.
Mm-hmm. Great. So what's next? What other challenges are in the works, and why were these topics selected?
So we have 3 more in the works, and to answer your second question first, because I love to go in order, really these challenges were selected because these are some of the toughest challenges that face our animal health industry, or our portion of it, which is the treatment, prevention and treatment of disease. So we carefully selected the biggest problems in animal health where shared class antibiotics represent a particular issue. And so the 3 I'll highlight, one is coccidiosis in poultry, and this basically leads to large-scale losses in the poultry industry, and it's due to parasitic infestation and growth within the GI tract as well. And again, akin to the necrotic enteritis, finding a solution that is not a shared class antibiotic would both improve production, but also improve it in a way that's more globally and ecosystem conscious. Another challenge that will be forthcoming are liver abscess in cattle. And this is a condition that affects cattle across the board, and unfortunately it's only detected when the cattle are put into production. And so what happens is upon discovery of liver abscess, that the meat from that cow has to be discarded. Currently, there's a preventative that's used, that's a broad class, shared class antibiotic, Tylosin, which happens to be actually one of Elanco's leading products. It's a broad spectrum shared class antibiotic, and we recognize that the broad spectrum use of Tylosin is not going to be sustainable, and as such, we're looking for a replacement to treat liver abscess that again will be ecologically responsible and meet the consumer needs. And then the final challenge that we're going to be releasing is proliferative enteropathy, known as ileitis, basically. It's another enteric disease, this one in pigs. Now, there's a number of shared class antibiotics, as well as even some vaccination strategies that are being used, but a combination of both the efficacy of these tools, as well as the regulatory changes that are happening, really are pushing us towards finding an alternative and finding that quickly. Because again, these sort of enteric diseases in food production result in a lot of loss, and as such, farmers attempt to treat their food animals with these shared class antibiotics. And so here, if we can find an alternative that meets regulatory standards that are really reflective of consumer demands, then I think we have, again, a good product that we can put forward.
All right. So to find these challenges when they come up, visit the Elanco Pavilion at www.innocentive.com/Elanco Pavilion. And for solvers who like to participate or in general in challenges, become a registered solver, and then you can log in to view these details and make a submission. We're always looking for new ideas and perspectives that you can bring. So as we mentioned earlier, we'll be providing a link to the webinar within each of the grand challenges. So are there any questions that have come up on the chat box?
Not yet. If anybody has any questions, please use the chat box to send it. It should pop up as sending it to client services, and we will work on answering your questions.
So I'd also like to mention that on the InnoCentive blog, we have an interview with Aaron Schacht, who is the Vice President of Global Research and Development at Elanco. And then we also have a separate blog post with more information in general about Elanco's Grand Challenge program. So to access these, navigate to blog.innocentive.com.
Okay. So we have one question from the InnoCentive webpage. It seems that there is a large number of participants. How many proposals you might expect to have for each challenge?
A question for me. In general, when you're taking a look at the InnoCentive active solvers, those are the people who are have decided to log in and view the details, which are available after you sign a challenge-specific agreement. The conversion rate, once people look at the detailed description and decide whether or not they have anything that they can put forth as a submission, anywhere 10-20% of those, and it really depends on how complex the challenge might be, and it varies. All right, another question is this program going to continue beyond the first 6 challenges that you mentioned today? David?
So right now we want to see what the responses are for these 6 challenges, but we have definitely left the door open for a potential round 2 on this Grand Challenge program. I think it really hinges on what kinds of solutions we receive and how aggressively we'll be moving on both those and other areas, because there's certainly more work to be done. So I would say keep tuned in, and potentially more to come.
Sounds good. And another question is, has Elanco considered any events to bring winning solvers together, or are you interested in working with winning solvers?
Potentially. I mean, again, that door we're definitely not going to shut, because if there's a truly innovative solution out there, and a solver is a subject matter expert, yeah, I would say we would want to reach out. Because again, our commitment here is to really develop solutions agnostic of where they originated from. We're humble enough to admit that while we think we have some pretty good scientists, we definitively do not have all these answers. If we did, we wouldn't be running something like this. This is us publicly acknowledging that some great expertise and some great insights might be out there, and I would hesitate to restrict our access to that innovation in any way.
Okay, we have one more question. So the solver says, I welcome the initiative of Elanco to reduce antibiotic usage in animal health. What kind of proposals do you expect? Innovators usually tend to submit completely new ideas, while companies usually tend to build on what already exists. How does Elanco plan to proceed with the information they collect?
So I think this is right. This is exactly on point to why we're doing this. What happens within a company is sometimes you create implicit bias. You put up blinders, and so us reaching out to InnoCentive is acknowledging that we may have some blinders on, and so the innovation we're looking at or we're looking for is narrowed only in the following respects. What we're looking for is something that is not currently used as a shared class antibiotic, something that treats or prevents a given disease, and what as a therapeutic. So, and that's important, because if it's a methodological change for production that addresses the issue, that's not something that Elanco is going to develop and produce. So we put that in some of the guidance for each of the challenges. But with respect to a novel therapeutic intervention, we're open ears, because personally, I mean, these solutions will be received by people like me and my team here in R&D, and we're looking to push the forefront of innovation here. So, if it's a viable solution, we're going to pursue it.
Another solver question. Though it's mentioned that all the challenges are theoretical challenges, still I want to know that practical experiments are not required.
No, I mean, if they're theoretical, we do want as much data support as possible, but you know, experiments that haven't been run, you know, we'll look at that in its consideration. If it's, you know, if it's just a guess, you know, that's not going to be as relevant as something that has some level of substantiation. So while you yourself may not have generated the data, we do want some substantiation for the hypothesis.
Mm-hmm. All right.
Are you obliged to finance the winning solutions for further development?
No, we're not obliged, but again, going back to the whole purpose for doing this, if there's a good solution out there, I feel personally, and this is me speaking, not necessarily a company, but I feel personally obliged to attempt it, to innovate. There's a number of reasons why something may not emerge to market, technical reasons, business reasons, but if there's a viable solution, the whole intention here is for us to internalize that and then start the work to see if it's a viable avenue forward.
Okay. All right. If there are any more questions, please submit them now. If not, you can always reach out to us through either the message center on our challenges or through our help center email. Should be innohelp@innocentive.com. Either way you do it, we will respond to you about that. Okay.
Since there aren't any more questions, David, do you have any final words of wisdom for our solvers?
Mostly, you know, I've really enjoyed working with InnoCentive because I believe it brings some of the best minds to bear on problems that you know, independent solvers may not have considered helping out on. We're looking for innovation, not necessarily expertise, and some of the best innovation comes from us. So please don't shy away because you don't feel like you understand the industry or you understand the developmental cycle. You know, be bold problem solvers, and we look forward to reading your submissions.
Okay, that's great advice, David. So really, thank you again for your time today, and we really hope that this discussion has sparked greater interest in the Elanco Grand Challenge program.
Thank you, guys.
Thank you, everyone.
All right, bye-bye.